Appreciate that.
Appreciate that. Okay. Now, our next speaker. Our next speaker brings a story that bridges the impossible gap between profound youth ambition and elite surgical mastery. He is a U.S. board-certified neurosurgeon with over 2 decades of experience in complex spine care, practicing across both Dubai and the United States, and is medical director and neurosurgeon at both YK Neurospine and Khavkin clinics. He trained at the University of Chicago and completed his fellowship in complex and minimally invasive spine surgery at Johns Hopkins University. Throughout his career, he has performed more than 8,000 neurosurgical procedures and has held leadership and faculty positions at institutions such as Northwestern, UCSF, and Johns Hopkins, all while spending 25 years backing global humanitarian healthcare. Having started his own journey as a medical student at just 16 years old, it is my honor and privilege to welcome our esteemed neurosurgeon, Dr. Yevgeniy Khavkin. Please write any questions you have for him in the chat, and we will share them in a 5-minute Q&A after his talk. Thank you. We will just put a spotlight on the doctor now.
Good morning. Good afternoon, rather. I guess it's morning where I am. Hi, guys. Can you guys see me?
Yes, we can see you. Thank you so much.
Yes, we can.
We'll put the spotlight on you.
Wonderful. Well, first of all, I apologize for my kind of this informal attire. I'm actually in Philadelphia right now. We're here for the World Cup. And my son, my 13-year-old son, he's actually the youngest football podcaster. So if any of you guys into football and you want to check it out, he is actually a podcast, and his social media platform is Noah Talks Football. So you guys can check it out. So, Zara, how much time do I have?
You have currently 10 minutes for your talk, and then we'll have a 5-minute Q&A after.
Okay, so sounds good, yeah. So I'll minimize my talk because, ultimately I want to, answer as many questions as you guys have. You cannot really compress the whole knowledge of neurosciences and neurosurgery, what I've been doing for 30 years into this, 15 minutes. But first of all, I want to express, my, admiration for those who have put this together. I had a brief conversation with Zara. I agreed to do this because I was so impressed with her enthusiasm and her maturity level. Zara, how old are you again? You're in high school, right?
Yes, I'm 16. I'm in high school.
I mean, it is amazing. So I know I see some applause there, but I want to applaud you and the people who helped you put this together because it's incredible. The fact that you did this and the fact that you actually gathered this community to learn more about this. And, I'm just excited to watch your bright future unfold. So congratulations on this. So I'll briefly talk about myself, and then I'll open to any questions you guys have. So as Zara mentioned in her very kind presentation, I'm a neurosurgeon. So I grew up in Russia, in Moscow. And the reason why I went to medicine is because I was following in my mother's footsteps. So my mother was a pediatric surgeon. And that's why I got such a kind of early exposure to medicine, because I was actually started to assist her. First observed her in surgery when I was like 14. And then I started assisting her in surgeries when I was like 15. That was back in Russia, so she allowed me to do that. And so I could not even imagine doing anything other than being in the surgical field because I liked it so much. And as Zara mentioned, I got into medical school in Russia when I was 16 years old in the Moscow Medical Academy. And then I moved to the States. And I was the first foreign medical student to ever transfer to American medical school. That was in 94. And so I did my medical school in Chicago, in the University of Chicago. I was very fortunate with my training. Then I finished my neurosurgical residency, University of Chicago. Went to Johns Hopkins, did my training in spine and complex spine. And then I went back and I was working at Northwestern. I was in a leadership position as a chief of neurosurgical spine service at the main campus at the Evanston campus at the Northwestern Medicine, and I was very much involved in training residents, training fellows. I had great colleagues, great people that I work with. And then I moved to Las Vegas. I opened a practice in Las Vegas. So in Las Vegas, I have a multi-specialty practice that combines in a number of specialties. And within neurosurgery, neurology, orthopedics, pain management. And then we opened a practice in Dubai fairly recently. So as Zara mentioned, my practice is between Dubai and Las Vegas. Even though I'm a neurosurgeon, that's obviously implies that I do both brain and spine. My main focus is spine surgery. And that's where my true expertise is. And again, as Zara mentioned, I've done over 8,000 spine surgeries, anything from minimally invasive to oncology, deformities, complex spinal reconstructions. And now I'm doing more and more regenerative medicine, for spine, use of the regenerative technology, stem cells, the exosomes. So there's a lot of exciting news, exciting advancements in the field of regenerative medicine, the spine in particular. And even though, again, my expertise, my primary focus is spine surgery, I always say that the best surgery is the one you can avoid, especially in the spine field, because most patients come to me because they have pain. They have pain in the neck, they have pain in the back, shooting pain in the arms and the legs. And we always try to maximize non-surgical, maximize conservative treatment options before we move on to the surgery. Now, obviously, it's a different situation when somebody has a evidence of the nerve damage. If somebody has weakness or somebody has problems with the compression of the spinal cord, of course, we tend to gravitate towards surgical options and become more aggressive as far as the surgical treatments. But a lot of patients who have problems with the spine actually get better without any surgical treatment. And I think that's very important to understand this part. Neurosurgery is something that has, I caught a piece of the presentation, from the previous speaker, Dr. Khan, and I think you'll see how fascinating the world of neuroscience and neurosurgery, specifically, how many different subspecialties exist, right? From pediatric to functional to vascular, skull base. You have a lot of advancements, obviously, with the spine. You have a peripheral nerve surgery. So there's a lot of different subspecialties. And that's what's exciting, is that as you go through the training, you actually decide what interests you the most. I initially thought I was going to go towards more of a pediatric neurosurgery because my mom was a pediatric surgeon. I did a enfolded fellowship in pediatrics, and I decided that I actually want to do more spine, and that's why I pursued my career within the complex spine surgery. So anyway, so this is kind of a little brief overview. I would rather just answer whatever questions you guys have. You can always reach out to me, whatever questions you can think of afterwards. My social media, my Instagram is YK Neurospine. I'm sure Zara can actually share my contact information. And listen, I've been mentoring and guiding students from high school to college to medical school to residence for many, many years. So I'm very, very happy to provide my opinion, my guidance, and share my expertise. And if it ever helps, somebody as far as making the decision what they want to do in life, it'll be my honor to be involved with this. So tell me what kind of questions, what you guys want me to talk about, and I'll be happy to cover it.
Thank you so much, Dr. Khavkin. That was very encouraging to hear about your journey, especially from such a young age, and you observed first at 14. So wow, that's incredible for all of the young minds here. And we will be taking questions from the chat. So if anyone has any questions for Dr. Khavkin, of course, after the conference, feel free to reach out to his Instagram handle, and we will put the social media details on the chat. But if you have any questions, just send them to me. Okay, so we have one question so far from Niska Malkin. She is a high school student interested in genetics and neuroscience. And her question to Dr. Yevgeniy is, do you think genetics will play a larger role in predicting or preventing degenerative spine disorders in the future?
Absolutely, absolutely. I think genetics is going to play a role in everything. because ultimately, I mean, listen, what we're trying to do now, we're trying to figure out how to fix the problem, right? Down the line, this is my hope, and this is going to be up to you guys. Probably one of you may be actually going to become this person who's going to, get this breakthrough. Is if we can somehow, first of all, be more predictive as far as who is going to be developing what kind of problems, that would be extremely helpful. But ultimately, as far as altering the course of the pathophysiology, altering the course of disease, I think genetics is going to be the foundation for everything. And this is exciting. There's a tremendous amount of research that's taking place. A lot of times, unfortunately, you hear all of this, news, so-called news from different parts of the world saying, "Oh, there's a breakthrough here. We found this. We found this." Most of the time, it's not exactly the case. Most of the time, it's just an exciting kind of marketing pitch. But I know I have a lot of friends who are actually doing very serious, very high level genetics research, and it's exciting. It's exciting when it's eventually going to be applicable to clinical world and to treating, preventing, hopefully a lot of pathologies. And yeah, no question, there's a future.
Okay, thank you so much for that response. We have another question from the chat. Al-Harith
Are they
Al-Halfi.
are they are they able to speak, or you just have to like read their questions? Or are they able to just?
Oh, we're giving them the option to choose live or
Oh,
chat,
okay,
but
I
they
got
can.
I got you. No, I always encourage direct interaction. So yeah, I mean, feel free,
Yeah.
obviously.
Okay, if anyone does have live questions, just put your virtual hand up. Um, or if you would prefer doing it by chat, you can do that as well, though we welcome live questions. It's obviously nice to have a direct conversation. So the question from Al Harith is, great presentation. You mentioned earlier that it is often preferred to take non-surgical measures. What complications are usually involved in spinal surgery that make it non-optimal, and how do you navigate this using these non-surgical methods?
Great question. And I'll tell you why I think it's a great question. Because a lot of times people say, well, I've done thousands of surgeries, not a big deal, let's just do it. There's no such thing as a not a big deal surgery, right? There's no such thing as a minor surgery. Every surgery is a major undertaking, no matter what, right? Every surgery, and the surgeries that I do, involves anesthesia, general anesthesia, which obviously puts stress on your heart, on your lungs. Every surgery has a potential complication of bleeding, infection, blood clots. And not only that, I mean, every surgery has a potential complication of death, of paralysis, of a heart attack. So surgery should never be taken lightly, even though people might like myself, I have a lot of experience with this, and thank God, knock on wood, I've had great outcomes, many thousands of times. But surgery should never be taken lightly. So if you're doing a surgery for something that is a life-saving procedure, which I've done many times, mostly in the brain surgery kind of situation, where you have a blood clot, you have a trauma, you have a brain tumor, uh, there's no question. The risks are justified. In the spine surgery, most of the surgeries are not done for a life and death situations. They're done to improve quality of life of a patient. And if that's the goal, then just like with anything else in medicine or in life in general, you always got to weigh the benefits and the risks, right? If the benefits outweigh the risks, it makes sense to do something, right? If the risks outweigh the benefits, maybe that's not the right decision. So in the spine surgery, it's always important to weigh those, benefit risk ratio to see how much potentially can improve patients' quality of life, what kind of patient's condition, right? I'll tell you, having been doing this 25 years, I've never seen two identical patients. Every single patient is different in terms of who they are, the quality of life, their health, their age, their functional level. So it's a decision that needs to be made on a case by case basis. Is it worth the risk of the surgery to proceed? So that's why we always try to optimize and to maximize non-surgical options. So what are the non-surgical options? Physical therapy, chiropractic treatment, injections. Injections can be done through either steroids, which is a common injection. It can be done with what I mentioned before. Now, regenerative medicine with the stem cell technology is advancing. There's a lot of controversy. There's a lot of unknowns still. But it's definitely something that is very promising. It's exciting. So I think it needs to be approached in a very careful and a very ethical way. Ethical. Because unfortunately, a lot of things in medicine are done not for the right reasons, financially driven. And it is very important to know what is right for a patient. And I always tell my students, residents, medical students, when you become a doctor, right, and when you treat your patient, and if you recommend something for the patient that you would not recommend for your mom, for your dad, for your best friend, then maybe there's something wrong about how you practice medicine. You should always put the ethical standards above everything else and do what's right for the patient. And it sounds trivial, right? It sounds like, well, of course, that's how you're supposed to do it, right? But unfortunately, that's very commonly this rule is broken and there's a deviation from that. The other thing I want to emphasize, and I know it was not your question, but I want to emphasize this. Listen, with all the advancements in the technology that we have, it's all exciting. We have all of this imaging technology, diagnostic technology, therapeutic. It's not a substitute for being a doctor. It's not a substitute for medicine, for truly doctoring. And the reason why I'm saying that, I cannot tell you how many times I see a patient and I sit down with the patient, I ask their, obviously take their history, do the exam, and the patient says, oh my God, I've been having this problem for 5 years, 7 years. You're the first doctor who actually sat down, listened to me, examined me, touch the area that is hurting to see exactly where the pain is. It's sad because a lot of doctors these days are just relying on the technology, relying on diagnostics, and they really forget about the true medicine and doctoring, where you actually sit down, you listen to the patient, you find out what the problem is, and you communicate. And this has become a challenge for a lot of patients. So don't ever, once you become doctors, if you decided to become doctors, don't ever forget the fundamentals of why you chose to go into the medical field.
Thank you so much, Dr. Kavkin. That was invaluable advice. And now, just because we have a minute left on this, we will take one more question, but if we would really encourage live questions. So if anyone wants to raise their hand, please feel free to do so. Don't feel, shy. We want to, take a live question so you can speak directly to Dr. Kavkin and ask him. I think we had a hand before, but
What happened to the hand?
I think they put it down.
Can I just pick randomly a person and say what question do you have for me? Like for example, Daniil. I just saw Daniil there and he just disappeared.
Yeah.
He was like at the top of the list or somebody. But again, guys, listen, feel free. Okay, here he was. Okay, where are you from? Daniil Rambekov. Where are you from? You mute. Yeah, there we go. Go for it.
Okay, so I'm from Kazakhstan.
Wonderful. Do you want to switch to Russian? But многие не поймут тогда, о чем мы говорим.
Okay, so
No, that's fine.
that's very interesting to me because, my question is, you are a great doctor, neurosurgeon, but do you prefer, do you having a balanced lifestyle with a sport, some kind of physical exercises? Because I think most of the doctors are just giving some kind of advices, but they are not doing this and that, but they are still looking good for their age or even how they communicate and so on. I know that this is very kind of personal question, but that's kind of interesting to me as a high schooler from Kazakhstan.
Very cool. Well, yeah, listen, I knew I should pick you. I saw him like, maybe he has a good question, and I was right. First of all, how come you speak English so well? Most people I meet from Kazakhstan really not fluent. That's impressive. Good for you. So listen, it's a great question, and you gotta do what you preach, right? So to answer your question, listen, I'm not right now hanging out, in the office or anything like that. I'm here for the World Cup, and again, shows you I'm very much about the balance, not just balance in terms of your physical activity and your sports, but just balance in life, right? That's important to no matter what you do, especially if you go in the medical field because it's so demanding, time-wise, commitment-wise. Never forget the priorities, right? Never forget that your priorities is still your balance, still your loved ones, your family. That's the foundation of everything, right? If you're fortunate that you do something you're passionate about, like medicine, amazing. Don't go to medicine for any reasons other than truly being passionate about this. Don't go into this for socioeconomic reasons or anything like that. That's the wrong thing to do, and you're going to be miserable. Figure out what you're passionate about and do this. Sports wise, yeah, absolutely. Actually, I do. I used to be a competitive swimmer. I actually used to have a band. I play guitar and I sing. Now, as you see, when I have three kids, I have a 15-year-old, 13-year-old, 10-year-old. The older one is all about basketball. My 13-year-old is about football, obviously, and definitely check it out. Noah Talks Football. If any of you guys into football and any of you actually care about World Cup, you guys should follow him. And then my little one, my 10-year-old girl, she's actually in Spain right now for the gymnastics competition, international gymnastics competition. So once you become a parent, you kind of start getting into more involved in the sports that your kids actually enjoy. So, but yes, balance is everything. And yes, you got to stay in good shape because listen, when you see your patients and you recommend something and you don't look like you're healthy yourself, I don't think there's much of a trust factor. So, but great questions. Listen, guys, I mean, we were given very limited time. I know Zara already probably like doing this, like, come on, the next guy's waiting. But listen, feel free at any time, reach out to me. I'm not one of those neurosurgeons who are like narcissistic, not approachable, and so you're welcome to reach out. You'll have my information anytime. Anything I can help with as far as helping you guys guide your decision in life, more than happy to do that.
Thank you so much, Dr. Khavkin. I'm sure all of us will, lots of people will be taking you up on that offer. And please, yes, do contact Dr. Khavkin on his socials, just for guidance or anything. Thank you so much for offering that, Dr. Khavkin, especially since there's like not much direct advice from neurosurgeons.
And Azara, listen, at your discretion, you're welcome to share my WhatsApp information, my Dubai number. I'm always available WhatsApp as well. And anybody from the audience, welcome to reach out to me. I'll be happy to help out.
Oh, that would be wonderful. Oh my goodness. Thank you so much for, offering
Of
that.
course.
We will definitely do that.
On by email, all his details and information, yes.
Yes, okay, we will do that. Thank you so much, Dr. Khavkin, for all of your input today. I'm sure our audience took away a lot from that. And
No, Zara, thank you. Seriously, thank you for doing this. That's incredible. And I'm very impressed. So
thank you so much.
Thanks for getting me involved.
Of course. Okay.
Okay, guys. Good luck to all of you.